Today's video topic is preventing athletic injuries. Well, that's easy. Just don't be athletic. The first step in preventing athletic injury is to get a preseason physical. A preseason or back-to-school physical is a great way to determine if your athlete is fit to play sports. Physicals help assess any area of concern for athletes before they start an activity, and in turn, keep them from further injuring themselves during play if a condition is present and needs to be treated. When it comes to preventing athletic injuries, providing a healthy, well-balanced diet is probably not one of the first things that comes to mind. However, it is important for athletes to eat a well-balanced diet full of fruits and vegetables and lean proteins. It is also important for them to maintain a regular eating schedule. For instance, having breakfast, lunch, and dinner at the same time every day. In sports like wrestling, where extra importance is put on athletes' weight, parents need to make sure that athletes follow safe eating habits such as not skipping meals. On the flip side, eating too much before exercise can cause stomach cramps and nausea. The next way to prevent athletic injury is emphasize proper technique and guidelines. Just like in gaming, in every sport there's a correct way and wrong way to do things. For example, football players are taught the correct way to tackle an opponent without suffering concussion. And baseball players are taught the proper way to throw and catch a ball and follow the proper guidelines, like how many throws they can make in a day. Just like in gaming, if you don't follow the proper guidelines techniques, one slip-up will cause you to lose a lot. Sleep is also very important. Athletes of all ages need to rest in between practices, games, and events. A lack of sleep and muscle fatigue predispose an athlete to injury. In fact, the most common injury in young athletes are overuse injuries, too many sports, and not enough rest. Along the same vein of thinking, parents should plan an off-season for athletes, giving him or her adequate time to recuperate before the next season. One treatment for any athletic injury is ice baths. Cold therapy has been around for a long time, but ice baths take it a step further. Cold water immersion causes the blood vessels to constrict, decreasing swelling, pain, and muscle spasms. Many endurance athletes should stand in ice baths for 10 minutes or less, whereas football players and other high-intensity athletes should stay for 10 to 15 minutes. This is because many runners and triathletes look at ice baths only to decrease soreness and pain, and also to be able to improve their endurance and running performance. Football players, on the other hand, mostly use ice baths for muscle recovery and pain reduction. Lastly, some statistics. More than 3.5 million children ages 14 and younger get hurt annually playing sports or participating in recreational activities. Although death from sport injuries are rare, the leading cause of death in sport-related injuries are brain injuries. Sports and recreation activities contribute to approximately 21% of all traumatic brain injuries among American children. Almost 50% of head injuries sustained in sports recreational activities occur during biking, skateboarding, or skating incidents. More than 775,000 children ages 14 and younger are treated in emergency hospital rooms for special injuries each year. Most of the injuries occurred as a result of falls, being struck by fan objects, collisions, or overexertion during unorganized or informal sports activities. Playground sports or bicycle-related injuries often occur among children ages 5 and 14 years old. The highest rates of injuries occur in sports that involve contact or collision. Many severe injuries occur during individual sports or recreational activities. Most organized sports injuries, which is 62%, occur during practice. Sources: hopkinsmedical.org, sports injury stats; verywellfit.com, how to prevent sports injuries; Pearson Health, Pearson Education, Inc.